When we suspect meningitis, what we want ideally is to start the antibiotics right away. But cultures take days to identify the causative organism. That's why we look at the patient's age and also the spinal fluid. We look at the opening pressure and analyze the cells, the amount of glucose, and proteins. Now, exactly how much CSF fluid should you take from the lumbar puncture? Normally, on average, almost 500 milliliters of CSF is produced per day, and the average renewal time is about 3 to 4 hours. During the lumbar puncture, usually 10 to 15 milliliter is collected for diagnostic purposes, which is estimated to be renewed in roughly 30 minutes. Now, a normal opening pressure is up to 250 millimeters H2O. The pressure of the cerebrospinal fluid that is detected just after the needle is placed into the spinal canal is the opening pressure. And the purpose of measuring the opening pressure is in fact to indirectly measure the intracranial pressure, or the ICP. The normal CSF findings include 0 to 5 lymphocytes, less than 45 milligrams per deciliter of proteins, and most of the proteins that is normally present is albumin, and then more than 45 milligrams per deciliter of glucose. Now, in bacterial meningitis, we see a high opening pressure, an increase in polymorphonuclear lymphocytes, or PMNs, that are a type of white blood cells that include neutrophils, eosinophils, basophils, and mast cells. These are WBCs with small granules that are sometimes released during the infection. These are found to be dominant in bacterial meningitis. Now, high levels of protein, which is due to the bacterial infection, makes the blood-brain barrier more permeable because of the inflammation. And proteins leak into the subarachnoid space from the blood, and that is why we see a high level of CSF protein. Next, we see less glucose, and previously it was thought that the bacterial cells use up the glucose in the CSF, which causes for the low levels of glucose. However, that theory was disregarded, and recent studies are exploring possible blood-brain barrier changes during bacterial meningitis, which limit the uptake of glucose instead. In fungal or tuberculosis meningitis, we see a high opening pressure, increased lymphocytes, and increased proteins, again owing to the inflammation and increased blood-brain barrier permeability and decreased glucose. And finally, in viral meningitis, we see a normal or elevated opening pressure, increase in lymphocytes, normal or increased proteins, and a normal level of glucose. So now let's discuss some common causative organisms for different age groups. Now, in newborns, it is usually passed on to them from their mothers by the vaginal canal. So they have unusual bugs that cause meningitis. The group B, Streptococcus, E. coli, and last is Listeria, which affects people with low immunity, so it's seen in newborns and elderly. Children from 6 months to 6 years, the most common causative organism is Streptococcus pneumoniae, then Neisseria meningitis, H. influenzae, group B Streptococcus, and enterovirus. In young adults aged 6 to 60 years, the most common is Streptococcus pneumoniae, then Neisseria meningitis, enterovirus, and herpes simplex virus. And in the elderly, the most common cause is Streptococcus pneumoniae. Then we have the gram-negative rods, which are Neisseria meningitis, H. influenza, and group B Streptococcus, and lastly Listeria, owing to the low immunity. Now moving on to the general outline of antibiotics given in meningitis. For newborns, we give ampicillin plus gentamicin. For children and adults up to the age of 60, we give ceftriaxone and vancomycin. And in elderly patients, we give ceftriaxone plus vancomycin and an ampicillin. Another thing you should know about the treatment is the administration of corticosteroids in order to reduce the mortality and morbidity in the bacterial meningitis, since this blunts the inflammatory response secondary to bacterial lysis. However, for any medication, the updated guideline should be followed, and steroids should not be given to children younger than 3 months or patients in whom you suspect tuberculosis, as this may be detrimental without anti-tuberculosis therapy. So by now you should be able to understand the CSF lab findings and figure out what sort of infection is causing meningitis, as well as a general outline on the treatment. For more videos like these, keep watching sqadia.com.